Georgia Davenport. She's the field director of Whole Washington, and amongst other things, she'll be speaking on how state-level single payer can lead to guaranteed healthcare for all, how HR 5010, or whatever the bill number might be in our 117th Congress, would make it easier for states to implement single payer, and how Whole Washington already collected more than 100,000 signatures in the past and is now on its way to another campaign to implement single payer in Washington state. So for a more official introduction, Georgia served as the Whole Washington campaign director and led the 100% volunteer effort to pass universal healthcare via ballot initiative in 2018. In 2017, she founded Whole Washington, filed the paperwork with the Secretary of State, and began all the necessary steps to form a 501c4 capable of running a campaign. In late 2018 and early 2019, Georgia, along with members from the Whole Washington Initiative Writing Committee and Senator Chase, met with the Revenue and the Employment Securities Department to vet I-1600 so that it can be introduced in the legislature as a fully funded and easy implementable bill. Georgia now serves as the Whole Washington Field Director, as well as the Field Director for One Payer States, an organization that advocates for state universal healthcare bills nationally. She also ran for state legislator this year on a Medicare-for-All universal healthcare platform. Georgia, we're so excited to have you here and can't wait to hear more from you.
Thank you for that introduction. I'm really, really excited to be here. And one of the reasons why I'm so excited to be here is because the opportunity to just collaborate with other groups around the country is an amazing, amazing thing. I know that all of us have been kind of operating in our own lanes for a very long time. I feel like we need to not reinvent the wheel with all these state groups. We need to really collaborate and share information and ideas. And in that respect, I'm so very, very excited to be here. Let me figure out how to share my screen real quick. Always a challenge. And I do live in rural Eastern Washington, so apologies if my internet isn't the best. But I'm tethered to my phone, so hopefully it'll be okay. But so today I'm going to go over the history of Whole Washington. I promise I'll keep it brief. I'm not trying to bore you, but it's pretty interesting to me because, you know, I'm not a lawyer or anything, but I really, really felt passionately about universal healthcare. So I did a lot of things that are way out of my comfort zone. For example, like Tammy said, I filed a 501c4 with the IRS, with the Secretary of State. All of those things I had never done before. We created a board, a steering committee, articles of incorporations and bylaws, all those things. 5 years ago, if you had asked me what any of those things were, I would have been like, no clue. So unfortunately, I had a great lawyer friend in Michigan who walked me through that process. And I've actually sent the line by line directions I followed to Stefan. So he has those too, if he could share those with anyone who's interested in what I did step by step to become a 501c4 for Whole Washington. But moving along, so I feel like that most of what's in this slide has already been said. I'm the field director for Whole Washington. I'm also the field director for One Payer States, which is a great organization that I saw in the chat, somebody was talking about states kind of coming together and working together. One Payer States is as a group that if you're interested in seeing what other states are doing, that's a great organization to become part of. And they have monthly meetings and a great listserv. So I encourage you to go to that website, onepayerstates.org, and get involved with that organization. I'm also a state committee member for the Washington State Democratic Party. I've been for about 5 years now with a few different legislative districts. And now I'm the state committee member for Stevens County up in kind of the northeast section of Washington State. A very, very red district. So I didn't win my race for state legislature, but that wasn't really my purpose. I would really like to win, but something I'll talk about later in the slideshow is that it's really difficult for organizations like Whole Washington, and I'm sure you've experienced this with your own organization, to get in the press. They're much more interested in talking to candidates. So I thought, why the heck not run? Just so I can talk about Whole Washington and Medicare for All. Whether or not I win, at least, I'll get some interviews. And it was true. As soon as I ran, press organizations that have never even batted an eyelash about whole Washington were all of a sudden really wanting to talk to me about my race. So my goal was every time I got an interview to at least say universal health care or whole Washington or Medicare for all 5 times in that interview. So I would actually do that in my mind. So I highly encourage anyone who wants to put themselves out there like that. It's way out of my comfort zone. Again, I never wanted to run for office, but if you think that you could, it's a great opportunity to talk about the issues. And I see there's several representatives with us today, so I'm excited about being able to tell them about my experiences too. So that's great. So what is Whole Washington? Whole Washington is a grassroots organization that started out of Initiative 735. I was a staffer for Initiative 735, which was the initiative to overturn Citizens United here in Washington State. We were supportive of HJR 48, which is the national bill, basically creating a new constitutional amendment that corporations aren't people and money isn't speech. When that bill passed, that initiative passed in 2016 by 64%, the campaign staffers were kind of like, what next? We know a lot about initiatives. What's the most critical issue we think that we need to push for via an initiative? And all of us agreed it was healthcare. Campaign staffers historically don't get healthcare because it's just too expensive, especially for grassroots progressive campaigns. It's just too expensive to get healthcare for their staffers. So we all felt very strongly that we needed to start a universal healthcare initiative. We ran an initiative. We got about 105,000 signatures, 100% volunteer. It was our first go, which is typical. You don't get the required amount of signatures your first time running an initiative, especially if you don't have a lot of money, which we didn't. We spent about $75,000. Most initiatives spend millions of dollars to get 300,000 signatures. We only spent 75,000. So that was pretty good. But just like most grassroots initiatives, we were gearing up to try again. The initiative that I was talking about before, 735, it started out as an initiative to the people, didn't get enough signatures, had to go again, and then won. So this is pretty typical for a grassroots initiative to have to go twice. So we were gearing up to go again, collect signatures again this year, but then COVID-19 happened. All the big events got canceled. That's what initiatives rely on here in Washington State, to collect thousands of signatures in one day. You go to like Folk Life Festival or Pride parades, that sort of thing, marches. Since all of those things got canceled, we decided to really focus on our bill in the legislature, which, great news, it was dropped in the Senate today. So it's been an exciting day for me. And we're supposed to have also a House bill dropped very soon. So that's great news for us, and we're excited that you all will have a bill as well. That's awesome. So yeah, we're gonna try to do an initiative to the legislature this year as well, but that looks kind of dicey. I don't know if we're gonna be able to run one, just because gathering signatures in person is so challenging right now, and we want to make sure that everybody is safe. I have a young child who might actually come in at any moment. I'm homeschooling her. So if we do get interrupted by a 9-year-old, I apologize for that. But, and then my parents live close by and I don't want to expose them to the virus. So we're kind of like seeing what's going to happen. But at this point, we're going to file the initiative and see where we're at in April to determine whether or not we'll collect signatures. Challenges of healthcare reform. So I've already talked about forming an organization or a campaign. You know, you have to have your paperwork in order and file as a nonprofit with the IRS and all that kind of boring stuff, technical paperwork. Another big challenge that I'm definitely willing to take questions about this, because maybe you've experienced it locally, is arguments over strategy. You know, we get, we have to do this nationally because states don't have enough money to do it. we have to do this by the state because it's never going to pass nationally. And then different like state groups have different strategies to get to single payer. And that's been one of, I think, the most demoralizing parts of my work in the last 4 years is just the arguments between different groups of like strategy, when I really feel like that's a waste of time. We just need to like all work together. No matter what strategy we are using, we just should support each other, because we're a whole lot stronger if we're supporting each other rather than infighting. Marketing. That was a big, we probably spent about 6 months talking about what we were going to call our campaign. Are we going to call it single payer, Medicare for all, Medicaid for all, Apple Care for all, you know? And so we actually did polling. It cost $4,000. I was part of the $75,000 that we spent during our campaign to do polling to see what worked the best in our state. And it was just very obvious that universal health care was the term to go with here in Washington state. I feel that like not very many people knew what single payer was. There are a lot of people who have kind of like an adverse reaction to it just because and I'm a huge Bernie supporter, so don't hate me for saying this, but just because there's a lot of divisiveness around the Democratic Party about Bernie versus whatever. So single payer is kind of affiliated with Bernie. So I feel like that's one thing that one reason why single payer didn't poll as well here in Washington. And also we didn't feel like Medicare for all was really accurate for a state level bill, and it didn't actually pull very well in Washington state either. So I've already kind of talked about getting information out about your efforts. A lot of the times the press is not really interested in talking about a campaign or an organization. They're much more interested in talking about candidates. So we ran 3 people, whole Washington ran 3 people this last election cycle. And we got a lot more press as a result. And now they're actually talking about us. We have some local newspapers that want to do articles about our bill once it gets a bill number. So that's pretty exciting. And I think that we really broke the ice with running some candidates. So one thing that Stefan wanted me to talk about, and it's kind of a little wonky, is the waiver restrictions federally. I'm just going to do one slide about it because, like I said, it is a little wonky, but I'm happy to go more in depth in the Q&A section. But so as you all might know, there are federal waivers that kind of restrict states from using Medicaid and Medicare dollars in state plans without you kind of requesting permission, essentially. So Ro Khanna has introduced this bill, HR 5010, which probably will have a new bill number, but it streamlines the waiver process so that we can get the most amount of administrative savings when we pass a universal healthcare single payer bill in our states. So that's one thing that whole Washington's really pushing for, because our ultimate goal is to get as close to single payer as we can in Washington state. There are a lot of loopholes that you need to jump through, unfortunately, but some of them are there because the federal government was worried that states might use Medicaid and Medicare dollars in a not so great way. So there's certain rules with those waivers, like you have to cover at least whatever the Medicaid program covers. Like here in Washington state, we have Apple Care. So with whole Washington, our program, if passed, would have to at least be as good as Apple Care, which it's actually as good as Apple Care, if not better. We cover vision, dental. Part of our bill allows us to negotiate pharmaceutical prices and that sort of thing. So it actually is better, but some states, you never know, if they have a Republican legislature, they might want to use those Medicaid and Medicare dollars for something else. And so that's why those waivers are in place. But Ro Khanna has this great bill to help us states out who want to expand healthcare to everyone in their state. Okay, so I want to talk a little bit about the campaign tools that Whole Washington uses. We use, for our database, we use Action Network. It allows us to send emails out to everyone who signed up. It allows us to do letter writing campaigns. So if we have like our bill, we want people to be able to go in, just put their address in, and with one press of a button, they can send an email out to their local state legislators about our bill. It's very easy to use. It allows you to create events, RSVPs, that sort of thing. It's a great tool and it's really inexpensive. We were using Nation Builder at first, but that was really expensive and not very reliable. This is only about $15 to $30 a month. We use WordPress for our website. We use ActBlue and Anadot for our fundraising. We also have every social media that you can. I even signed us up for TikTok, but I don't really know how to use it. So hopefully we can get some younger people to do some TikTok videos for us. And we use Slack and Trello for like our organizing tools. So like if we want to organize tasks to different members of our volunteers, we can say, can you create this graphic for us, for our graphic designers, that sort of thing. Allies, One Pair States, we've already talked about them. They're great allies. Other state groups, please reach out to other state groups. That's what Whole Washington has been doing. I've talked to at least 3 other state groups in the last couple weeks. And another great group that I always like to point out is Red Berets for Medicare-for-All. They knit these wonderful red berets, and they're great to wear to marches with your buttons on them. State-based reform. That's how Canada did it, province by province. I really believe strongly that this is the best path to getting universal health care in the entire United States. But we do also support Medicare for All with Whole Washington. We went to the Medicare for All hearings. We've organized barnstorms, car caravans for Medicare for All, but we're really committed to not only getting it passed in Washington State, but other state groups. So with other state groups. So that's why I'm here today, is I really want to create those bonds and that coalition so we can get this done state by state. So I want to talk a little bit about the benefits of the Whole Washington Health, the initiative and the bill that we have. We wanted to model it after Medicare for All, which, 100% coverage, no deductibles, no crazy deductibles, no out-of-network costs, vision and dental is covered. And you can see the entire list of the benefits on our website. We actually hired Dr. Gerald Friedman to do a funding study for us. If you're not familiar with Dr. Gerald Friedman, he did the funding study for like the National Medicare for All plans and a bunch of other state plans, just to see. We have some challenges here in Washington State. We don't have an income tax, so we had to get creative with how we were going to pay for this. We have 13 billionaires here live in Washington State, and like I said, we don't have an income tax, so they pay zero. So the biggest contribution is from those billionaires. We have an 8.5% capital gains tax in our bill. We really wanted to get healthcare for everyone, but we also wanted to de-regressivize our tax system here in Washington State. We have the most regressive tax system in the United States. One of the biggest challenges of collecting signatures or just anything, just talking to people about this, is they always want to know, how much am I going to pay for it? So we partnered with this great group called the Progressive Coders Network, and they created a savings estimator for us. So if we're out talking to people, we can just pull up our website. They can put in their numbers of how much they currently pay for healthcare, and then they get to see how much they would save if the Whole Washington Health Trust passed. So that's a great tool. I would definitely encourage you checking it out. So, with me, my family would save about $2,000 annually if the bill passed. So like I said earlier, big news today for me, it was huge relief. Our bill dropped in the Senate. Sometimes it's a waiting game and you have no control over that. So I was pretty nervous. I was biting my nails, but it did drop today. But if it doesn't pass, we're very lucky in Washington State to have the initiative process. We can collect signatures, get a ballot measure on the ballot, people vote for it, and it becomes law. The governor doesn't even have to sign it into law, it just becomes law. So we can circumvent the legislature if they refuse to take action. So like I said, we did polling to determine the best language for our bill and for our initiative. We've been doing fundraising for the last few years to get ready for running our initiative. We have a goal of 3,000 volunteers that will pledge to collect signatures. Right now, we have about 200 volunteers who have pledged to collect about 200,000 signatures. We can file in March. The deadline to collect signatures is January 2022, and then it would be on the January 2022 ballot. So I want to talk about current events. So I don't know how many people here were following the Force the Vote discussion that was happening recently, mainly on Twitter, but there was a lot of infighting. And it was a little demoralizing for the past few weeks, but I think that some great things have come out of the last 2 weeks as far as getting the pay-go requirements dropped for COVID-related bills. So Bernie and Pramila Jayapal have this great emergency healthcare legislation that they've introduced. They introduced it in 2020, and they're planning, I believe, I just saw an article by Bernie saying that he was pressuring Biden to pass this bill. So I think they're going to reintroduce it. And because they dropped pay-go restrictions for COVID-related bills, this bill could just go right. It could get done. It's actually pretty exciting. And I know that a lot of organizers, including some organizers in one-payer states, believe that if that bill got passed, that so many people would be really, really happy with that change that there would be no way that anybody would be for taking that away. And we could expand to Medicare for all because people would see how great the system works. So that's really, really exciting development. As you all know, all the countries who have gone to a Medicare for all system have never gone back. So I feel like once we get there or get very close to there, people will go, oh, this is what everybody's been talking about for so long. Yes, we want this. So I'm really excited about that bill. And I'm really excited about state groups joining together. Like I was saying, you know, if we band together and we have a unified front, we can fight the insurance companies and the pharmaceutical companies that much easier. All right, sorry that took so long. I don't usually talk this long. So I'm really, really happy to take any questions at this point. If anybody wants to ask me anything, I'll stop my share right now.